Hypertension in itself, or high blood pressure, does not exhibit symptoms. You might not know that you have high blood pressure until perhaps your heart weakens due to having to pump blood throughout this high pressure in your body. And eventually, the vascular system, or the piping, takes its toll due to the relentless high blood pressure. If your plumbing system in your house was under a lot of internal pressure, structurally, what would happen to that plumbing system? It gives away, right? And that's what's up with today's health topic, hypertension. That's your internal plumbing system, and under the high pressure, that structure will eventually weaken. Apply that analogy to your vascular system, and you're at higher risk for developing heart disease or stroke. It's your body telling you that it can't handle that high pressure anymore. Let's prevent hypertension together. Our health system solution is not about prevention, but to prescribe antihypertensive medications once your body can't control that high blood pressure. So it's imperative for your health to know what your blood pressure is. Did you know that on average, it will cost around $360 to manage your high blood pressure with medication? $360 individual cost equals about $1 a pill a day. If someone was on one type of antihypertensive medication, this potentially means that it costs pennies to manufacture these pills. It's then the best interest for pharmaceutical companies to have as many patients with hypertension. Even physicians sort of think along the same lines. When I questioned two medical doctors about why hypertension is so rampant, their response really surprised me. Apparently, it's easier to prescribe cheap medications than to educate or inform patients on how to prevent hypertension.
No way.
It's harder to do that than to do a prescription. So what's your experience with diagnosis of hypertension or your prevention? Does this comment surprise you? It surprised me. Hello everyone, welcome back to my channel, The Imperfect Human Systems, where we talk about health conditions and systems that affect our lives. In today's video, I will cover how your system, or our system, is inadequate for preventing hypertension, largely because it's easier to give medication to control the high blood pressure versus prevention. Now, given that fact, I'll cover what you can do for yourself to prevent hypertension. Let's see what's behind this persistent rise in high blood pressure, or the hypertension rate. First, we know that 120 million people have hypertension, or nearly 50% of the US population. Now, do you think that number is really high? 50% of the population in the United States has hypertension? Well, let's look at those recommendations of lifestyle modifications plus medication. The two most important lifestyle modifications are diet and exercise. We kind of all know that, right? And if you have hypertension, that's first, and then the medications. So with the numbers shown, if the entire 94.9 million people are on antihypertensive medications, and on average, they're paying about $360 annually, let's do the math to potentially see what the yearly profit is for the big pharma companies. That's 94 million people. Multiply that by $360 equals to, bang, $33 billion potential yearly revenue for just the high blood pressure medication alone. Now let's look at a different calculation. Data indicates there are 33.1 million people on at least one antihypertensive medication. So let's multiply by $360. That's what the individual pays per year. That equals to at least over $11 billion in revenue for the pharmaceutical companies that produce this. Then let's dive a little deeper into why you would want to be in the controlled bracket versus the uncontrolled bracket. And that's because hypertension, even when taking medication to control your high blood pressure, hypertension in itself, you are putting yourself at higher risk for heart disease and stroke, two leading causes of death in the United States. Given that the health system is not set up to prevent hypertension, as you can see, what can you do for yourself so that you don't develop hypertension long term? We go back to that lifestyle behavior changes, the diet and exercise. Well, you may ask, what's enough exercise, EJ? Well, the American Heart Association recommends 150 minutes per week of moderate intensity aerobic activity. Aerobic exercise is when you bring your heart rate up. So let's check your resting heart rate. Are you resting right now? Well, if you are, place your two fingers of your right, place it on your left hand. And there's this radial artery that runs across along the outer part, placing the two fingers very lightly, and you will notice there's a pulsation, and that is your heart pumping blood throughout your body. Have a watch handy when you're ready and when you're at rest. And then count the pulse for 15 seconds. And mine is usually under 10. And multiply that by 4, and you will get your resting heart rate beats per minute. A normal heart rate is usually around 60 beats per minute to around 100. Now, you probably have noticed that some athletes, especially marathon runners, have a lower resting heart rate. Now, sometimes those activities include maybe just brisk walks, biking, mowing the lawn. And I don't mean the one you sit on the mower and you just kind of drive around. The ideal lawnmower for exercise, I think, is the manual mower that my dad used way back when. Remember these? Why don't we have these anymore? Well, because we like convenience, right? We want to do things so fast. 150 minutes a week works out to be about 20 minutes a day. 20 minutes a day. Can we shave that off from, let's say, browsing the internet, maybe taking a brisk walk? Now, you might have noticed that some athletes, especially endurance runners, tend to have a lower heart rate baseline below the 60. I have had my heart rate measured at around 40s. And the concept is that if you continue to do your aerobic exercise and you raise your heart rate during your periods of aerobic exercise, essentially means that you are exercising the muscle of your heart, which is extremely important for cardiovascular health. And when your muscles, your heart muscles, are strong, what happens is that it doesn't need the number of pumps or the beats in order to perfuse your blood throughout your body. So technically, if your heart rate is below 40 and you're in a healthy state, that means your heart has to beat less than 60 to perfuse your whole body. And that's a good thing. I know two people, young male adults in their 20s, who were overweight and they had high blood pressure, which in today's definition, that's blood pressure that's over the 130 systolic, which is the top number, and the 90 diastolic, which is the bottom number. In talking to them, they altered their diet for the better, and they saw their weight go down. But what also went down was their blood pressure. And that's where exercise and diet is so important. What's available as empirical data based on research, is that healthier weight or weight loss contributes to better blood pressure control. And generally, overall good health. Let's prevent hypertension together. Obviously, our health system's solution is not on prevention. And for hypertension, medication is essentially prescribed when your system has already been compromised. So if you have any other topics that you'd like for me to present and discuss, please leave that in the comment. And again, thank you for watching. And don't forget to subscribe to my channel if you found any of the content of this video or any of the other videos helpful. Until next time, be well.